This is Cecilia Jimenez, and this is her mom, Jimenez. Wow, what's been going on today?
Well, CJ returned from Mexico.
It was from Mexico.
A few days ago.
Mexico.
Yes.
Spring break, eh?
Yeah? Oh,
Crazy.
good.
She's had a fever for the past 3 days. Stuff's
Really?
been coming out
Everywhere.
from everywhere, and it just I have no idea. It's just
Does she have any other conditions we should be aware
oh,
of?
she has type 1 diabetes.
Type 1 diabetes, okay.
And she just hasn't been eating lately. She just can't keep anything down. So we
Okay.
haven't been giving her insulin.
So when was the last time she got insulin? It's been a couple days?
Yes.
Okay. So it's been a couple days without eating and insulin.
Right. She can only tolerate just a couple sips of ginger ale, and if not, she's just
Can you tell me, like, how often is this vomiting happening?
every other time she tries to drink something. It's just I feel so bad. She just cannot keep it down.
Okay, what about, is it diarrhea?
Yes.
Is that, okay, diarrhea going on.
It's been disgusting. I love you.
Is this often as well, the diarrhea?
Yes. Yes. I don't know what's going on.
Okay, and so, you know, you're pretty familiar with taking her blood sugar, right? Because of
Yes.
diabetes.
Yes. It's a
And-
lifelong struggle.
Oh my goodness, I cannot even imagine. So, when was the last time you took that blood sugar reading?
I don't know. The last time I took it, it just told me it was really high. I think it must be broken because the last time it usually
just
pops
said
up a number
high.
and it just says high.
Hi.
So everything's going wrong. She's like this, and then the blood monitor's not working.
So you said she hasn't been urinating very much lately?
She was fine, and like when she first got back, and then she just slowly stopped urinating, and I don't think she's gone at all this morning.
I'm going to be wearing a perfume.
She's
Are y'all
been
wearing
smelling
perfume?
like that, actually. Her breath is very sweet.
So we're going to do, we need to do an assessment. We're going to get some vital signs on you. We'll be right back. Let's start with talking about what are some things that you noticed about the patient?
Right. Let me think about it, Liz.
What seemed irregular or...
She was breathing really fast, deep, fast respiration, and I smelled something of a Fruit Loop.
DKA commonly affects patients with type 1 diabetes.
Oh.
Have you heard of DKA before?
I think I have, Miss.
Okay, so it's also called diabetic coma. They have symptoms such as hyperglycemia, acidosis, dehydration. Did you notice any of these in our patient?
Absolutely.
So this is where there is a profound amount of insulin deficiency, not just like a little bit of insulin deficiency, like a ton. So do you think she had insulin deficiency?
Sure do, Miss.
Why?
She hasn't taken her insulin. And now that I think of it, she hasn't been able to keep anything down either.
Exactly.
Oh, I
You are
see.
totally getting this.
It seems like all the puzzle pieces are finally coming together.
They are. They really are. If left untreated, these imbalances can cause shock and even death. So she is lucky that she came in, isn't she?
Absolutely.
Okay, so what kind of, you said deep, rapid respirations. Do you remember, are those called anything?
Small
respirations,
small respirations.
What else did you notice?
Let's see. I guess her mother said she had a high blood glucose level.
Yep. Too high for the monitor.
Nausea, vomiting. She was pretty out of it. Something like a drunkard, if you know what I mean.
Yes.
Fruity smell and breath, thirst, oliguria, and flushed skin.
Wow, you're really getting the hang of this. Hello? Okay, we're going to move her to the ER. Okay, we'll do that. Yes, we are just moving CJ to the ER where she can get the best care possible.
Okay, let's do this.
We just received orders from the doctor. We've got a lot of orders here, so we've got to get going. First, we need to start an IV. Have you ever had an IV before?
Yes, I think so.
Okay, so my extern is going to do your IV today. She's never done one before, but I am sure it'll be great. Never! Oh my god, it's gonna be great.
Yes, trust me.
We're also gonna need to get some labs from her from this IV. We're gonna need to get potassium and we're gonna get ABGs. We're just gonna do a rainbow, cover all our bases. So we're gonna do that first. First try, oh my goodness, she is a pro. We're gonna need to start some fluids, some lactated ringers. We're gonna hook you up to some monitors. This will get your ECG monitoring taken care of. And let's see. Oh, we also need to do a continuous infusion. So we need to give acetaminophen, and since you're kind of out of it, swallowing, and we don't want you to throw up. So
I've been doing a lot of that lately.
exactly, and so in your best interest, we're going to have to do rectal acetaminophen. We're going to monitor your vitals once every shift or every so often.
Don't you think that maybe we ought to check our vital signs a little more often than once per shift?
Oh my gosh. Oh my god. I was about to kill her. Oh, thank goodness. I am so happy that you told me that.
Who are we
Oh my.
kidding? I beg your pardon.